the death toll in the Eastern Cape floods has risen to 14. Infrastructure such as healthcare facilities were also affected by the heavy rains in the Buffalo City metro. Health MEC Nomakhosazana Meth is visiting government facilities today to assess the state of the damage. Here's Sipha Kema with the detail.
The Eastern Cape MEC of Health, Nomakhosazana Meth, is out doing assessments, of course, of different healthcare facilities to assess the damage caused by floods. Let's listen into what she is going to say.
Heavy rain that affected this clinic, the Nokia CHC. It flooded, but we are still busy with the assessments as we speak. In terms of the costing, we shall finalize that by Thursday. But already we have started to restore some services that were interrupted because seemingly the pre-assessment that was done by the technicians, they found that there was a blockade or a pipe was blocked or a drain was blocked, which caused therefore water to go back to the gutters, and that caused the flooding. And the reception area was affected, the maternity, and many other services except for trauma. Doctors' rooms, pharmacies, and many areas were flooded. But at least we were able to quickly deal with that. On Sunday, there was a sucking of that water that was full in the clinic here. Already by Monday, electricity was restored. Even the backup generator could not work, but it was fixed. So there was disruption on Sunday and 1 hour on Monday. So all services were restored. As we speak now, we've got that preliminary report, but we are busy doing the assessment to check what are the actual damages that happened. But generally, water was all over, windows, walls, and many areas were affected. But I'm still to go door to door to see exactly and be shown by the leadership of the clinic what exactly happened. But we are thankful to God that nobody was injured and the services were restored on time.
Now, MEC, from your understanding now, is that when it comes to Cecilia Mekwana, as far as you have been told or reported, are you expecting, a major damage to the hospital?
Not really. I think it's the same thing that has happened here, but fortunately with Cecilia Mekwana, the contractor that built that hospital is still able to come back because we are still under what is called retention or warranty. But it's not major damage that has happened. I so believe that I'm still going to Cecilia Mekwana after this visit here.
Are there any other health facilities in the province that have been affected by the rains, recent rains, and what damages and what are those facilities?
Not that I know of now in this recent incident, but in December, as we all know, in particular in Amatole, there were severe damages, roofs were blown away, and many clinics had to close down. About 54 clinics were affected across the province. The assessment that we have done so far, it shows that the cost is over 20 million of those 47 that have been accessed, but we are still busy finalizing that. We received some reports of the others from BCM few that we are still to go and do assessment, but the damage that was caused in December 1 is severe, and there's a lot of work that we still need to do, but working with our Department of Public Works and Infrastructure, we shall be able to say once the disaster is being declared, how do we swiftly move using the disaster framework processes of procuring services. But we're expecting at least that the contractors must be on site not later than the 18th of January on all those facilities whose infrastructure was damaged.
Having spoken to the SA Weather Services this week, they said more rain should be expected this week. So are there any plans that the government has made to ensure that the damages are minimized in case of more rains pouring?
Unfortunately, the natural disaster, in particular the cause of strong windstorms and rains, you can't say you can prevent that from happening. We're just praying it doesn't come as strong as it was previously. But we just are saying our people must be vigilant, be on alert, make sure that when the weather starts to show that.
That's the Eastern Cape MEC Health, Nomakhosazana Meth, of course, giving us a briefing and a breakdown of exactly the assessment that she was given by the healthcare officials regarding Notyatyambo Clinic. But from here, she is moving to Cecilia Makiwane Hospital to assess the damage there. But as she said that at least the contractors there are still under retention, so they will be able to come back and assist the hospital should there be any severe damages to the hospital infrastructure. For Newzroom Afrika, Channel 405, I'm Sipha Kema in East London.